Tonight, in the Alfred Hospital's intensive care unit.
If I get your tongue, you can hear me, Zach.
He's got 20 to 30 separate little areas of hemorrhage in that brain.
His passion was the Navy. That's where he's going in 3 days, which I don't think he'll get to now, obviously.
You had your heart operation.
I suppose what didn't go to plan was that the new donor heart wasn't as strong as we hoped.
You stand in front of your mum and she could potentially die.
There is ongoing bleeding.
The ladder just gave way and I fell 3 metres down into a timber deck.
The bleeding can be life-threatening.
The sickest patients, the most advanced technology, medical care second to none. It's always a matter of life or death. In the trauma pod of the Alfred's ICU, the team is quickly setting up for a new patient.
This is Zach. He's an 18-year-old man who was involved in a car accident in which his primary injury, or his main injury, was his brain.
Zach has been flown in from Bairnsdale in country Victoria.
Sats and everything's been fine, gases have been good. Social-wise, I've got his mum, Kay, and her best friend, Kay. They're both down in the waiting room and they have seen him. They understand that the next couple of days are critical. I think it's been explained pretty well by neurosurgeons that he will have some form of a brain injury.
This is the CT scan of Zach's brain. You can see there's a large round area that's quite white that is bleeding into the brain. Now I'm going to scroll down through this brain. They're all over the place. There's about half a dozen on this slice. The bottom part of the brain here, and you can see again more hemorrhages. So he's got 20 to 30 separate little areas of hemorrhage in that brain.
The bleeding in Zach's brain is bad. Preventing it from getting worse is the ICU team's top priority.
Anybody with a head injury this bad is at risk of a number of secondary injuries, and it's our job to try and prevent those.
When Zach crashed his car, his brain got a terrific jolt. Zach's brain is so bruised and swollen that it's pressing against his skull. This causes more bruising and swelling. It's a vicious cycle that will lead to permanent damage. To try and reduce the pressure, doctors have inserted a drain into Zach's brain. It acts like an overflow pipe, allowing fluid to escape and giving Zach's brain room to swell.
Yeah, look, it's an important thing to say that he's very young. A guy of this age, even though this looks severe, we'll do everything we can to give him the chance of a best recovery.
Zach was about to start out on his own. But now his mother Kay faces the very real possibility that she may have to care for him again, permanently.
And I suppose being 18, he liked his girls and the cars and the mates. But I think his passion was the Navy. That's where he's going in 3 days, to his Navy interview, which I don't think he'll get to now, obviously.
29-year-old Ben was transferred up to the ICU from emergency at 2 a.m.
So his hemoglobin was 84 this morning.
I was working up on a roof, doing all the timber cladding because I'm a painter, and the ladder just gave way, so it threw me off and I fell 3 metres down into a timber deck.
Ben landed hard. He hit his head and collapsed a lung. But the biggest worry is his injured spleen. The spleen is a filter that plays a vital role in your body's health and immunity.
10 to 15% of the body's blood flow is seen by the spleen every minute. So you can imagine if there's an artery in the spleen that's bleeding, and the bleeding can be life-threatening.
When Ben hit the deck, he ruptured the tough capsule that protects the spleen, and his blood started to leak into his abdomen.
We could see bleeding on the CAT scan, so that's why we then went to the angiography suite with a view to plugging the bleeding artery.
The surgeons have tried to save Ben's spleen by plugging up the bleeding from the inside. They inserted fine metal coils to do the trick. Now they need to keep a very close eye on it.
It was a bit scary to think, oh, well, now I'm coming up to intensive care because my injuries are probably worse than what I think they are. Like, I expected to go to work today.
There's no way Ben could go to work. Something as simple as a sneeze could trigger another round of bleeding. In the cardiothoracic pod, the ICU team is caring for Janet after a heart transplant.
No, that's fair.
It's what?
Janet came out of surgery a few hours ago, and things have been rocky ever since.
I suppose what didn't go to plan was that the new donor heart wasn't as strong as we'd hoped. And when it came time to ask the new heart to take over, it was inadequate in its ability.
After the transplant, the surgical team inserted a balloon pump to help the new heart pump Janet's blood around her body. They also put her on ECMO, a heart bypass machine to take the blood out of her body and fill it with oxygen. It's hoped that together, these treatments will give Janet's new heart time to recover before it has to stand on its own.
Unfortunately, in the previous few years, we've had a number of hearts do the same sort of thing when the new donor heart doesn't work. So we're getting a little bit better at getting patients through what is otherwise a potentially lethal problem.
Obviously, this is the ECMO.
This is the ECMO circuit, that's right, yeah.
Janet has waited 2 years for a new heart. Her son William and husband John thought now her troubles would be over. This latest setback is a lot to take in.
Any surgery has its risks. Doesn't make it any easier, but the quality of life was such that the risk was something we're both prepared to take.
There's a great team and a lot going on and the best practices and environment for her to be in, but at the same time you realise that you're standing in front of your mum and she could potentially die.
In the Alfred's intensive care unit, it's day 5 for Zach, who injured his brain in a single vehicle accident. His mother, Kay, has barely left his side.
He's heavily sedated so that his body can rest.
Fortunately, the drain inserted into Zach's brain to relieve the pressure is working, and his brain has finally come down to a normal size.
We had quite difficult intracranial pressure control. Yesterday, we decided we'd just not rock the boat. And you can see he had a low intracranial pressure all day yesterday. And we didn't change his sedation. And his circulation stayed quite stable. Blood pressure's good, heart rate's low.
Now David needs to find out how badly Zach's brain has been damaged.
What are his pupils doing?
He can tell a lot from Zach's automatic responses to light and stimulus.
So they're smallish, but not tiny. Has he got a lash or a doll's eye reflex? No. No. Has he got a doll's eye? Let's have a look.
Zach is in a deep coma, and even with the sedation reduced, he shows no signs of waking up.
Okay. Is he coughing when you suck him out? Not coughing? Nothing.
The doctors can't give Kay the news she so desperately wants to hear.
We had to be fairly clear with her and all the family that he might not have a good recovery at all, and at best his recovery will probably be incomplete. His worst outcome is that he'll remain in a coma or being awake with eyes open and what we call the lights are on but nobody's home. That means he doesn't know who he is or where he is or what's happening.
Rips your heart out, I'll tell you. It does, it's hard. It's hard for Zach. It's hard, very hard to say.
In the cardiothoracic pod, heart transplant patient Janet remains in an induced coma on the heart-lung machine. It's 2 days since her transplant, and the new heart is still not working properly.
So shall we go to the meeting room?
Yeah, fine.
See you, Beckers.
Cardiologist Angie wants to be sure Janet's family understands what's going on.
There are cases now where it's becoming increasingly recognised that the heart, once it goes in, does decide right from the very start that it doesn't want to work. A lot of these patients would have died in the past. And over time, our experience over this has been such that it often takes a few days whilst the heart's settling in before it decides, gradually, that it's going to start working again.
And many people go through similar situations, but just that waiting game.
Yes. You know, we see a lot of patients, but she's your one mother.
Yep.
And we completely understand that. She's part of the ICU family at the moment. She's part of our heart failure unit at the moment. You know, we see her that way too. She's our patient.
No one knows if Janet will make it. It's up to her new heart, the heart of a stranger, to pull her through.
I feel a lot better today than what I have the last couple of days.
It's 2 days since Ben fell off a ladder and ruptured his spleen. His dad and girlfriend have arrived from interstate.
I got told he's bleeding internally. I don't know much about a spleen, but the internal bleeding's not a good thing. So that really concerned me. So I spoke to him and Ben said, don't come down, don't worry about it. But I sort of could tell he wanted someone to come down.
Ben may be awake and talking, but his spleen is not healing as quickly as it should. The team is very concerned about his latest CAT scan.
The most worrying thing, I guess, about this scan is this area of whiteness around there, okay? That means there's active bleeding, okay, somewhere.
So it's actually, it hasn't gotten any worse, but it's not improving itself.
Well, there is ongoing bleeding. We know that because we can see that from the scan. So they may decide it's appropriate to go back and do the re-embolization or even an operation, a splenectomy.
It's not the news Ben was hoping for. If the bleeding doesn't stop, doctors will have to operate and Ben could lose his spleen. In the Alfred Hospital's intensive care unit,
Open your eyes, Zach.
Zach's been in a coma for 6 days since his car accident. His sedation's been wound right down,
Squeeze my hands, please, Zach. Squeeze my hands.
but he's still not responding.
Poke out your tongue if you can hear me, Zach.
Has he got any responses at all?
He spontaneously coughs on movement and he will move his mouth around and blink his eyes if you're suctioning or doing his mouth care.
That spontaneous cough may not seem like much, but it means he's starting to wake up.
He's got a tiny bit of eye opening there, hasn't he? He's actually got a bit of a, that's present.
And that's fantastic news for Kay.
Today's a great day. Heaps better. His skin colour, his bruising's going, and he just looks like he's going to come back to me.
It's 3 days post-transplant, and Janet's new heart is still refusing to beat. She has to rely on the heart-lung machine to keep her alive, but there are risks.
So you've got too many tubes and lines in there. I don't want any increased risk of infection.
So Angie and the team are trying to wean Janet off the ECMO or heart-lung machine.
This is a very finely balanced procedure in that we need to balance how her heart is coping with how much we can push it to see what it will be able to do when we lower the flows. And a lot of it depends really on what Janet's heart and what Janet's body will allow us to do.
If everything goes according to plan, Janet's heart should gradually pick up the slack and start beating on its own.
That's a significant improvement.
Much better. Now we're on 1.5.
We'll take the new
Do you want to get
reading, so
colours?
that's
Colours needs to see this. This is very exciting. This is good.
It's working.
It's better.
The strategy is a winner. After 2 days of reducing her dependence on the heart-lung machine, Janet's heart is beating up a storm.
It's very rewarding when this happens. This is Janet's body doing what it's supposed to. It's lovely. Yeah, it's nice.
It's a great day for the team. Janet's ready to come off the heart-lung machine.
For us, it's incredible now to see after a few days when there was literally no function in the heart, it was just a saggy-baggy thing just sitting in the middle of the bottom of the chest doing nothing, to now having sort of returned a full function. So it's, I mean, literally you had a patient that in some units you would have withdrawn support saying we can't support this patient. But through the use of this technology, we now have a viable survivor who's going to go on and do well. And you can't be unhappy about that.
It's 3 days since Ben came into the ICU with a ruptured spleen after a fall from a ladder. It's been touch and go, but the bleeding has finally let up.
So Ben, we got the blood test results back this morning. That suggests to us that while there may be a small degree of ongoing blood loss, I think it's safe to say you're definitely heading in the right direction. You're well enough to head off to the ward.
That's good. That's good news.
No worries. Yeah,
That's really good news. I'm ecstatic now. I feel, the people say go and buy a lottery ticket or something, because it's just, I didn't realise that there was this much involved in an internal bleeding. I've been in the building game for that long that you sort of get a bit cocky with what you do on the job site and that. So even though I'm safe, I'll now just be taking, that extra precaution all the time instead of just, a lot of the time.
Over in the trauma pod, Zach's progress has been slow but steady.
You're in a safe place, Zach. Mum's here. Each day's a day. We're on day 10, so yeah, we're getting through the days.
Zach's managed to get his breathing tube out a few days ago, which I have to say surprised us at the time because his original scans showed quite a degree of injury. And each day he's probably waking up a bit more.
Do you know where you are, Zach? Yes, you are in hospital. That's the first time he's remembered that. That's good.
Every tiny step forward is a godsend. But for Kay, there's no guarantee that she'll ever get her spirited young son back.
You're tired? Yeah, that's okay. You can have a sleep. What's concerning me the most with Zach, that he'll stay like a little baby, not knowing what he's doing. And that's not what he would have wanted. We'll work hard together and see where we go.
In the Alfred's ICU,
Janet?
heart transplant patient Janet is waking up to some incredible news.
You had your heart operation and it's been successful. You had it a week ago. Okay. Now you have a breathing tube in your throat, Janet. And hopefully we're going to take that out today.
4 days later, Janet's well enough to see her grandchildren.
You say hi to your night? She's got her eyes open, which just meant such an enormous amount to us, because last week was a pretty weird week and we didn't know what was really going on, and I just wanted to come in and see her with her eyes open. For Mum to see the kids was great. I mean, just seeing the look on her face, I think it did an enormous amount to lift her spirits. We're just so happy that she's getting better.
Janet's new heart took some time to kick in. But now, there's no stopping it.
Working really well, Janet. That's fantastic.
3 months ago today was the day when I got the new heart. So I had my new chance. My second chance. Actually, realising the enormity of what's happened and how lucky people are when they have a second chance and survive. That's just, gives me goose pimples, actually. It does.
It's 11 days since Zach came to the Alfred after a terrible car crash. The ICU team has done everything it can to give Zach the best possible chance of recovery. And now he's being transferred to rehab.
Zach.
2 weeks later, Zach is back at the Alfred for his exit interview with neurosurgeon Greg Mallam. He's made incredible progress.
Good seeing you. So just point with your finger to the side that's my finger's moving. Good. Go back and forward fast as you can. Fast as you can. Yep. Back fast as you can. Touch my finger.
Just seeing him more aware of what he's doing is a really positive thing. Zach has come a long way from having tubes and all sorts of things.
You've made a a great recovery from a very, very severe car crash where you were driving far too fast. And what we don't want you to do is do this again, because you won't recover as well, damaging your brain again.
It's been a hard lesson for Zach to learn. He's hoping now that he'll be able to get on with the life he had planned.
Is that what you want to do?
I had applied for the Navy.
Have you?
And they had accepted me.
You know, you've got an excellent chance of passing the medical and getting on with your Navy career.
Yeah.
So it's all go from here, isn't it?
It's really good. Well, feeling really good, second chance in life, and I'm going to make it work.
We were thinking we weren't going to get all of him back. So to see him stand there and talk and know who we are and be alive, he looks so great and so normal. And I feel very lucky that I've got my boy back.
Next time, in the Alfred's ICU.
He's had a bad accident. Fortunately, he's still here with us today, because not everyone survives this injury.
You really only have to go through it once.
Black is good, and it's not enough black in those lungs to make us happy. This is a genuine setback and disappointment. Just one stage at a time.
Yep.
But that looks like a very severe brain injury.
She's 5 out of 5 in terms of severity.
As a priority, we'll make sure she's comfortable. And after that, it's just a matter of time.